Assalamu alaikum, everyone. My name is Karar. I'm an internist and I do palliative care. So I didn't give a presentation because I can't talk about diabetes and hypertension and heart disease in 5 minutes. I mean, these are hours. But if you have questions about diabetes, hypertension, heart disease, high cholesterol, we will certainly love to answer those questions. They're all related, so any one of us can answer that. So great question. What are the symptoms of diabetes? So they vary. So usually what we'll see is people will go to the bathroom frequently. That's one of the biggest signs we see. We also see people who are very thirsty. They're constantly drinking water. Another sign of diabetes is people will have like a burning sensation in their feet bilaterally. That's an early sign of diabetes as well. And then some ladies will have infections, like urinary tract infections constantly, and that sometimes is a sign of diabetes as well. So if you're having those things, then certainly have your sugars checked. It's a very easy test to do to diagnose diabetes. The thing is, in our population and in the Asian population, it's much more common. In the Latino population, diabetes is much more common, and that's related to the food we eat. So for example, like the iftar, you see there's a lot of rice, not a lot of salad, lots of potatoes. And so genetically, we're predisposed to diabetes more than the regular Caucasian American. Their diets are much more healthier than ours are. So for example, if you look at an American diet, there's salad at every meal, including breakfast sometimes. They eat a lot of fruits compared to what we do. Our meals are not complete if there's no meat, on the plate. And so, our diets, and then the other thing is we don't exercise often. We have a very sedentary lifestyle. If you look at the American, they very much go to the gym. Even when they're 70, 80, they're walking around their apartments. The husband and wife will be walking together. If you go to the regular gym, you'll see them on the bike cycling. And then if you see us, we're probably at home watching television, ZTV, and I'm not sure what else you're watching, but so those things add to your, to the risks of diabetes and heart disease overall. I'm gonna let we hate when a dizzy person comes to us, we hate it because it's the worst thing. We don't know what to do with them, and I'm gonna ask Onali to answer that question because he sees more of it than I do.
So dizziness and giddiness is a very common symptom that we see, and there are very, very, very many different causes. So first and foremost, the cardiac causes, the heart causes of dizziness are generally more common than the neurologic cause of dizziness. And so when somebody comes with me and says I'm dizzy, so first I ask them, what do you mean by you're dizzy? Because everybody has a slightly different meaning to what is dizzy. So and another question I sometimes ask is, are you dizzy in the head or are you dizzy in the legs? Because some people are unstable on the legs and they call that dizziness. Some people are, having lightheadedness and they call that dizziness. So then we ask about lightheadedness. Are you lightheaded when standing up? So if you're laying down and you suddenly stand up and you feel lightheaded, that is suggestive of a condition called orthostatic hypotension. It means your blood pressure is dropping when you stand up. And there are many different causes for that. There are different treatments, but you want to make sure the heart is okay, the kidneys are okay. Usually in simple cases where it's just orthostatic hypertension, basic treatments could be like salt. Sometimes people just have low salt, and increasing salt a little bit can help that. Wearing compression stockings can bring the blood that's pooled in the legs back. So that's orthostatic hypertension. And then we ask about spinning sensation. Do you have a spinning sensation? Is the room spinning? And if that is there, then that's called vertigo. Vertigo has very many different causes as well. So the most common cause is a condition called benign paroxysmal positional vertigo, or BPPV. So in order to be balanced, you have inside the ear you have 3 semicircular canals. They're at each different plane. They have fluid in them and they have crystals. So when you move your head, the semicircular canals move and the fluid in there moves. So your body can tell where it is in space. Now, sometimes, especially as you age, a crystal gets loose in one of these canals, and so these people then experience sudden onset spinning, room spinning, especially when they turn a certain way. Usually early in the morning they turn in bed and suddenly the room is spinning, or you have this, or what we say chakri, and that is very easily treated. It's treated by maneuvers called, there are a couple of them. There's Epley maneuver or Samont maneuver. There's some medications that can block vertigo for some time, like meclizine, but ideally you want to do these maneuvers. But then there are also central causes of vertigo. So if you have these symptoms, you should talk to your doctor so they can try to tease apart, if it's central or peripheral. Central causes of vertigo are many, but the most concerning ones are acoustic schwannoma. So it's a tumor, or it's a brain tumor that can cause that. There's a condition called Meniere's disease. It's generally genetic. It runs in families. It causes hearing loss, sensation of sound in the ears, tinnitus, and dizziness. And then there's vestibulitis. So you can get an infection of the inner ear, and for a short time you have this vertigo, and then it goes away. And then there's several other causes of vertigo as well. And then the third other cause of giddiness then is, so for you to have balance, you need three systems. You need a system called proprioception. So you have nerves, and the nerves in your feet tell you where your feet are, and they send this message to the brain. So when you're walking, you know where you are and you're not dizzy. So you can have a problem with that. You need the vestibular system, and you need vision. So you need all these three systems to be good, to ensure that you're not dizzy. So proprioception, vestibular system, and vision. So problems with the proprioception could be neuropathies. So he mentioned, one of the symptoms of diabetes is, feeling burning sensation in the feet. That's because you have a neuropathy. The nerves are affected by diabetes, and bad neuropathies can lead you to be giddy and dizzy as well. Similarly, the back of your spinal cord, called the posterior column, is also important in this. So there's a lot. It's very broad, very wide, and if you're having these symptoms, you should talk to your doctor. A good neurological exam can try to tease apart, where the problem is, and then treat it accordingly. Sure, go ahead. Go ahead, Mohammad Ali.
Could you make dietary recommendations if you want to build muscle mass?
To build muscle mass, I'm gonna give.
You want to build up the muscles in the eye? Is that? I'll defer.
So you want to put on muscle, right? So you want to bulk up. So I think the best thing to do is go to the gym and protein shakes. You got to be a little bit careful about protein shakes because sometimes they can affect the kidneys. If you change your diet to more of a protein diet, so more of the white meats, fish, the lean meats, I think you will end up putting mass on yourself. One thing that I've noticed, and I think people will agree with me, is I think genetically, it's very hard to see like an Asian, who's big. Very rarely will you see that, and I think that's a genetic factor in us. Oftentimes what we'll do is we'll grow big here. As we go, we don't grow big here. But if you look at, if you compare our counterparts like the Americans, they if they just go and lift a few weights, they're like big in a week, and it takes a lot from us. And I think that's even genetic. So there's a genetic component to it. So don't feel bad if you don't put all those muscles. You can try the protein shakes and see if they work, but then I would go home and blame your dad and tell him, hey, listen, you didn't give me good genes. But eating healthy is just is key, though. I have a question for all of you, if you allow me to. So how many of you check your blood pressure at home on a regular basis, maybe once a day? So what do you think a good blood pressure is for anyone? Anyone can answer.
70, 110.
So 110 over 70. All right. What else? Any other answers?
The ideal is 120, 80, right?
So 120 over 80. The ladies want to jump in. Good. Good. Yeah. Good. So, the reason I asked this question is because hypertension, like Dr. Kaku can tell you, is one of the risk factors of strokes. So hypertension, high blood pressure, is a silent killer. So oftentimes we walk around with these high blood pressures, we won't have any symptoms, and then all of a sudden people will have a major stroke. And once you have a major stroke, it debilitates you, as I'm sure you people have seen in the community as well. So there is no correct answer for the blood pressure, unfortunately, and everyone's been fighting back and forth. And one year you'll see that the blood pressure is 120/80, and then the next year it's 140/90, and there's no one knows what the blood pressure is. And so, if you speak to the cardiologist, they want to be more aggressive with your blood pressure. If you have heart disease, they want your blood pressure to be around the 120/80. Someone said 110/70. So, what they're seeing now is the lower your blood pressure is, like the 100s, the 110s, you just have to be careful, because if you are getting dizzy or you're feeling weak, then your blood pressure is a little too low. So you need to back off on the medications a little bit. If you're now over 80 years old, 80, 85, then what we do is we're a little bit liberal with the blood pressure. But we aim for about 140, 150/90. And that's because the side effects of the medications outweigh the benefits. Because when we put people on these medications, then they tend to fall because their blood pressures are too low. They have side effects. They're getting up at night to urinate. They trip. So the risks of those medications outweigh the benefits. So definitely I would encourage you, a couple of things is, simple things you can do is try and cut down your salt intake. In America, this is the #1 biggest problem. As you follow on the news, the FDA is saying that we should stop caffeine products for our kids. Our kids are getting fatter by the day. It starts like when they're teenagers, and so when they turn 40, they're all obese. So cut down on caffeine. Salt, we love salt in our food. If you cut down on salt in your food, you can bring your blood pressure down by about 5 points. So if you're about 145, you can bring it down to 140. And then the other thing is exercise. If you do 30 minutes of exercise 3 times a week, that will help bring your blood pressure down as well.
What if you have low pressure? What's the remedy?
So how low is your pressure?
About 104.
Do you take any blood pressure medication, can I ask?
I
Yeah.
don't have high pressure.
So you're blessed. So we should get your genes, because if you have low blood pressure and you don't have any symptoms, like if you're getting up and you don't feel dizzy,
Sometimes I feel, sometimes only I feel like fainting or lightheaded.
is it like,
Not fainting, but lightheaded.
is it during the month of Ramadan or just in general? Okay. So so I think if you have low blood pressure, that's protective, because many people, like my wife, has low blood pressure as well, and when she goes to the doctor, it worries them a lot. But she has no symptoms, so that's good. If you're having symptoms, then I would advise you to do the opposite, maybe to increase a little bit of your salt intake, wear the compression stockings, because what it does is it takes the pressure from your legs and pushes the blood upwards and stuff like that. But we often see the other part of it, the high blood pressure rather than the low blood pressure.
On the high blood pressure,
Gee.
your introduction talked about hypertension. What do you understand about the cause of glomerulonephritis? Is there a relationship between the two? And then I'm trying to explore the actual cause of glomerulonephritis.
So great question. So Uncle, I'm sorry, your name? Uncle Murtaza asked a great question. Uncle Murtaza is asking, what is the relation between hypertension and kidney disease? And so that's a great question. And why do we worry about blood pressure? Who cares about blood pressure? And the reason we care about blood pressure is when you have blood pressure for many, many years, what it does is it affects a couple of things. So we talked about a stroke, right? So people will develop a stroke because the vessels in your brain can't tolerate that pressure. They burst, it bleeds, and then that's not a good thing. The other thing with blood pressure is it affects your heart. So if you have blood pressure, that's a remedy for heart attacks. The third thing you can do, and this was where Ali Raza will come in, is it affects your eyes. high blood pressure affects the vessels in your eyes, and there's certain changes that he can look for and tell you, hey, you need to be careful about your blood pressure. It might cause permanent damage. The fourth thing it can do is what Uncle Murtaza is asking. It can actually affect your kidneys. So some people, when people ask me what's the brightest organ in your body, many of the cardiologists will say the heart, but it's not the heart, it's actually the kidneys, the brain. You see, everyone's arguing. So the kidneys are very, very important because they control homeostasis. They control your blood pressure very, very importantly. But if you have high blood pressure, what happens is you destroy the blood vessels to the kidney, and you can end up with kidney disease, chronic kidney disease. The thing is, if you control your blood pressure, you might prevent that disease from progressing. So there are certain glomerular nephropathies that are associated with hypertension, but I think if the goal is to control that blood pressure well. And I think that will help prevent further kidney disease. Now, one of the things that I wanted to add that we take for granted is, we are big into taking Motrin and Aleve and naproxen. Everyone has it at home. And if you take a lot of that affects your kidneys as well. So be careful, because these over-the-counter medications like naproxen, Aleve, Motrin, those, if you take them quite often, they'll affect your kidneys as well.
Any relationship between protein leak and the kidney function?
Protein link?
Protein leak.
Yeah.
Symptomatic of glomerulonephritis.
Yeah, absolutely. So the question is, what happens when you have chronic kidney disease? So your kidneys are, like I said, the brightest organ in your body after the brain. So what happens is when you destroy your kidneys, they're not able to reabsorb stuff back. And so what happens, you end up losing stuff. And so one of the things you lose is your protein. And that's the definition of glomerular nephropathy. And yes, so the question is, how do you control that? So number one is definitely, a nephrologist will be following you for that. And the second thing is making sure that the things that make that worse, you've taken care of.
I was more trying to explore the causative effect, even if you're taking care of it.
So, there are many causative factors. So, there are genetic causative factors, hepatitis C, hypertension. It just needs a thorough workup. Lupus can cause it as well. There's a bunch of diseases that can cause glomerular nephropathy. So hypertension is the most common because we see it often in the United States. Yeah.
You mentioned about palliative. What is the meaning of palliative?
Good. That's a great question. What I do is, another part of what I do is I do palliative medicine. So this is the medicine of people who are at the end stages of dying. So for example, people who have end-stage heart disease, people who have end-stage cancer, people who have end-stage, people with strokes, when there's no chance of recovery, they call palliative medicine, and what we end up doing is we make those people comfortable so that they pass away in peace and in dignity and in no pain. So that's another complicated thing that I do. So it's a great question you bring, because there's a lot of conflict with religion, what Islam allows, and palliative care, and so we're still exploring those questions with Sheikh Noor. So I don't go to the hospice, but what I do is I do the acute thing in the hospital. But yes, it's associated with hospice care. Yes.
I wanted to ask you, can you throw light on dementia and Alzheimer's disease?
Sure. So dementia, so what is dementia? There are many different kinds of dementia. Alzheimer's is the one that's most well known, but there are actually many different kinds of dementia, including Lewy body dementia, Parkinson's disease dementia, frontotemporal dementia. So dementia is basically a disorder of the brain where it's a degenerative disorder, meaning parts of your brain degenerate. They start, you start losing the function of the brain, and it impacts memory, thinking, language, and it's more common with aging. So the common early signs of dementia are forgetting things, and especially forgetting new memories. So, for example, somebody may, as they age, they may remember things that happened 30 years ago very clearly, but they can't store new memories. So maybe you tell them that this person had a baby or something like that, and the next time you talk to them, it's as if you've never told them. So those are some of the early signs. Amongst the other early signs are not being able to do things they used to do very well, like not being able to balance the checkbook, so bills go unpaid, or not being able to cook a meal when before they used to be able to cook a meal. Driving becomes an issue. Near misses, so having accidents, getting lost in places that you're familiar. So these are amongst the early signs of dementia. What we do when somebody is suspected of having dementia, we do a neuroimaging test, usually an MRI. We check the blood for reversible causes of dementia, things that can be reversed. So for example, thyroid disease, if it's untreated, can mimic dementia, can look like dementia. B12 deficiency, syphilis. Syphilis is an infection that can go to the brain, become neurosyphilis, and can mimic dementia and can be cured. And then we try to do cognitive tests. There are several different tests to tease apart what kind of dementia it is. Is this Alzheimer's dementia? Is it Lewy body dementia, frontotemporal dementia? So Alzheimer's is the most common, or at least the most well known. Lewy body dementia is a dementia where you have some features of Parkinson's. So it's a difficulty moving. You have a lot of hallucinations, seeing things that are not there. Frontotemporal dementia is a type of dementia which affects mostly personality. So people who are generally very shy, suddenly they become more jovial. They start joking. They say things that are inappropriate. These are much rarer, but these are all different kinds of dementia. And there are some treatments, some medicines, but these medicines just slow down the dementia. We don't have any treatment yet that reverses dementia. We don't have a cure for dementia. There are some things that are protective. So learning another language, being bilingual, is actually protective. The more educated you are, the higher your education level, the more protective against dementia. So it's very important to stay active, to read, and to make sure you're exercising your brain as well. So I was told by the task force team that we have to wrap up. So I think we'll take the last question and then wrap up. Numbness. Okay, so there are many different causes of numbness. So if it's both the hands, you want to make sure the cervical spine is fine. You can have a stenosis or narrowing of the spine in the neck, and that can cause numbness. Neuropathy can cause numbness. Usually it starts in the legs and then goes to the hands. It's very broad, and it depends. So if it's numb in a particular area, a stroke can cause numbness, but usually it's more than just numbness. It's weakness and numbness, but those are amongst the common causes of numbness. Vitamin deficiencies, B12 or B6 deficiency can cause numbness as well. Sure.
So, do you have numbness? Yeah. So why don't you do this for me? Just do this like this, and then just leave it like. Does that make the numbness worse? Just leave it like that. Yeah. Does that cause the numbness to come? Are you feeling the numbness now?
Yeah, because I've been through medicine, 10 years of cancer. So the doctor told me because of side effects.
Yeah.
So I just have medicine. She told me to take mine. But it's better.
It is. The other thing that causes numbness of the hands is carpal tunnel syndrome. So oftentimes, like if you do this, what happens is you're compressing the nerves and then they fall. It's a diagnostic test. If you do that, it will cause numbness of your hands. And we see that commonly as well. And that's treatable. You can wear splints at night to keep your hands straight. And because what happens is when you wake up in the morning at night, because we curve our hands at night, and so they become numb at night. And so what will happen is if you just wear those braces and keep them extended, inshallah, you'll feel much better if it's carpal tunnel syndrome. Yeah.
And chemotherapy is associated with a neuropathy. So you have chemotherapy affects the nerves, so you can have numbness from that too. But it's important to rule out carpal tunnel syndrome because that's easily treatable. Okay. So I think we'll finish, and I think Mustafa Bhai is going to give us a few words.